Hello, everyone. Dr. Van Merkel here. It's great to be with you today. I've got a little case study here for you on depression. And this patient's got a few other very common problems. I thought I'd just do a quick little share with you. 58-year-old male, 6'4", turning 32 pounds. He's had major depression from life events, and antidepressants are not working. And, one hardship after another. Doctor says he is stone-faced, no life. I'm wondering whether antidepressants are doing that to him. One, since antidepressants are not working, if he were to stop those, do you have any experience with your patients that have done this? Yes, I have. Are you aware of any risk involved in stopping abruptly? And he's open to going to the MD about maybe stopping his statins, and he is on the SPN plan. So I want to go just about review the meds a little bit, because I think so many times people are on medications and they don't realize the medications are contributing, driving the very condition that they've got. And so here's a list of meds the patient is on. And so I'm going to relay this in relationship to the labs we're going to see here in just a minute. But this amlodipine directly causes skeletal muscle tissue breakdown. So remember that. He's on Lipitor, and Lipitor causes diffused muscle pain, muscle weakness, and tenderness. Okay, that's related. And then we go to bupropion, also known as Wellbutrin, and those. And I know you have patients who are on those medications. Well, look at the side effects of these medications: agitation, anxiety, confusion, hostility and fatigue, delusions, disturbed concentration. Well, those aren't really good things, are they? Now remember, they study these drugs one at a time, so we really don't know what's going to happen when you start mixing a bunch of them together. You may have a significant multiple effect. Patient is Neurontin for antileptic medication, and this causes nervousness and, look at this one in red, depression. Yeah, patient's main concern is depression, and they're on a drug that directly causes depression, lisinopril for blood pressure. And you can see a lot of things going on here with that. Nothing specifically for depression, however. Toprol for hypertension, directly, one of the first side effects is depression and mental confusion. Not good things to be on, especially if depression is a primary complaint. And another antidepressant. Now, the side effects of these antidepressants always just amaze me, because the symptoms are, as well as everything else can go on: anger, hostility, confusion, decreased concentration, disorientation, lightheadedness, fatigue, headaches, insomnia, and impaired memory, nervousness, and it goes on down, so many of those. And again, not good things that I'd want for someone who's depressed. And one of the things that I talk about with antidepressants is I've had so many patients tell me, who's been on them for a while, that antidepressants may reduce their depression. But as the doctor mentioned, every day is gray. Sure, they never feel really, really depressed, but they never feel excited. They never have great days and vital days where they could just feel like they can run a mountain. No, they just don't feel bad. And I've heard that term so many times. Every day is gray. No sunshine, no rain, just gray. But that's life, isn't it? Life is up and down. You have a bad day today, knowing the sun's going to come out tomorrow, your day's going to be better. But that's just a part of it. Some days you feel bad, depressed, lonely, whatever. The next day, it's a whole different day. But with these drugs, every day is the same. You know, in my opinion, if you are never having a good day, despite the fact you are having really, really bad days, depressed days, wouldn't that be kind of severely depressing? And I know I've written it down here. I'm not trying to be predictive or a psychologist or anything, but if every day was gray, I believe that's one of the reasons why these people are more suicidal on these antidepressants, because they never feel good, they never feel bad. Well, what's the use? What is the use? How sad is that? And I'm going to go back to that. I'm going to go to the labs right now. But remember, the medications that people are on may be driving this. may be driving the very condition they're trying to resolve. When we go to labs, this patient is diabetic, early diabetes. The glucose is high. The A1C we'll see here in just a minute. The A1C is 6.5, so not severe, but the creatine kinase is high, and he's on 2 or 3 drugs that could directly cause this. Now, he may be a weightlifter, a bodybuilder, that kind of thing. Maybe he exercised really hard that contributed toward it, but definitely the meds he's on could drive that too. His thyroid is fine. There's some testing I'd like to see here. I don't see any liver function. If he's got depression, I'd like to see an LDH, creatine kinase. I definitely want to check kidney function. With so many drugs, oh my gosh, how could you not want to test kidney function on something like that? Because kidney disease is so rampant today. And so we see those things in here. And it's possible this patient is a weightlifter or on some medication or some natural stuff because his insulin-like growth factor is so high. Now, that helps to build muscle. Bodybuilders use it. And it's thought to help with longevity, but it also, insulin-like growth factor also contributes toward tumor growth, to cancer. So this is not something I'd recommend anybody take. In fact, his fasting insulin is low. Maybe his body is producing less insulin, and you see his C-peptide is low. So overall, whatever he's doing, it looks like he's inching toward diabetes, maybe even type 1 diabetes. Not a good thing. And then we go on some other things. The progesterone is high, and I would suspect if he's on testosterone or hormone like muscle building, bodybuilding drugs, he's going to have problems with hormones, and his estrogen, estrogen is high for male. You'll find these people who are on testosterone that they're going to tend to get higher levels of female hormones because the bodies try to stay in balance. So there's some other tests in here, which are important. I think and you can see some of the things that should be resolved. The zinc, etc., could be contributory toward a lot of things. We also don't see a hair test. And toxic heavy metals can be a big factor in depression and neurological mental problems. So those are things I would do on this patient. Get a little more thorough blood testing done and a hair test. As far as stopping the meds, I don't just have them stop the meds, although some people do because they're not working and they see the side effects. And there's really no harm except for the blood pressure drugs. I would not have them stop the blood pressure drugs or even consider it. But the other ones, as long as they're educated and they choose to make that decision to stop the drugs themselves, then all I just test them, keep in touch with them to make sure that they're doing okay. But generally, we see very good results with people who are depressed because the brain is an organ. If you have deficiencies, imbalances, or toxicities, the brain can't function either because the brain is the most sensitive organ to nutrition deficiencies, imbalances, and toxicities. So get everything tested. I'd work to get him healthier so he doesn't need so many drugs, and I'll bet that depression will take care of itself. We still have life issues. Those things happen. But if you feel better, you'll be able to deal with them better too. So I'm Dr. Merkel. Dr. Van Merkel, that's me right there, president of Science-Based Nutrition. I've been doing this work with this and other serious metabolic problems for over 30 years. And check back in. We're going to have some more cases and things that might give you some information on how you can help yourself or help your patients. Have a great day. I'm Dr. Merkel.